Hi class, welcome to Module 2. Your first step in this module, if you notice, was a video before me with a less than 2-minute explanation of what is epidemiology. We're going to start this chapter and this module exploring those issues of what is epidemiology, why it's important as we start looking at the sociology of medicine or healthcare as we look at it, and what factors come into place, because we really are exploring the social issues and what comes and affects the population related to disease. Now, if you recall from the last chapter and module, we talked about two different focuses of medical sociology, one on the medical system as an organization, the other on the issues of disease and how it affects the population. So we're starting off in that area. So I'm going to pop over to the PowerPoints as we start talking about some of these issues that come into place. So it is especially important today to consider the difference between disease and illness. As we face modern societies, the issue is not usually diseases in the same manner that it is illnesses that come into place, and we deal with chronic illness, and that makes a significant difference in modern countries. Yet we face the issues of disease as well, and what comes into place. As I said, and you've watched that video, epidemiology is looking at the distribution of disease, and social epidemiology looks at it based on the social issues rather than the biological issues. It's interesting as we look historically into why the length of age has grown so dramatically and why children survive their first year of after birth so much more. It is tied to many of the social factors and not just the medicine factors that come into place. So it's important that we tease out what's going on with the population. The other thing is your introduction to epidemiology is the rates are important, the portion of the population that experiences a circumstance. It's interesting as this semester I'm also teaching social problems. We look at the fact that social problems are determined by the society, not always by the number that what we consider are important. Right now, in this year, we're having very high flu rates. The flu shot that was made up is not overly effective. It's effective. It's more effective than not having a flu shot, but it is not resolving the issues of flu. So we're starting to see the numbers come in of the number of people who die from the complications of flu. In fact, my cousin's husband just died last week at 65 from the complications from flu. Very, very upsetting as we think about the issues of illness coming into place, and the effect of disease. As your book indicates, and this is where we're really relying in these first few chapters on a lot of book material coming into place, these incident rates are important to measure, the new occurrences given in a period of time. And I'm going to ask you to be watching the news for some of those as we look at the flu rates come in the United States. And the prevalence rates, that's the total number of cases given during the time. We also look at age-related rates as they come into place and see how they affect things. So very important as we understand these rates. Now, more terms from epidemiology include the term morbidity, mortality, life expectancy, and acute disease versus chronic disease. So morbidity is the number of cases that come into place. Mortality ties to the death count. Life expectancy, no surprise to you, is the length of life expected in any particular society or culture or breakdown within the process. And then we look at these particular issues, and we'll look at them throughout the course of the difference between acute disease and chronic disease. So, multiple things are going on within this exploration. So, examining illness takes on many forms. Currently, the modern disease profile, we look at the new rise of infectious diseases. Now, think about infectious diseases. In the past, we would see things like the plague, and they would establish themselves, and we didn't know how it was carrying. We found out that it was the fleas on rats, the unsafe conditions. We established what protocols to stop it. We had a whole war on polio, the March of Dimes fighting it in this country, the establishment of the Salk vaccine and then the Sabin vaccine, so that people were protected from polio, basically eliminating polio in the world, and now having just a few outbreaks in some third world countries. But there has been a new rise in infectious disease, and it's very tied to a number of things. First, we saw the rise of HIV and AIDS, not understanding the disease, a new infection, how it comes into place. Other infections such as Ebola, which became a very large scare, and the fact that we did not have the drugs available to treat that disease. We have seen an increase of diseases that are antibiotic and drug resistant. We have used antibiotics to such a level that the disease bugs actually become superbugs, as we call them. They advance themselves, they mutate, and they grow, and therefore can affect the population. So diseases like MRSA, that many of us carry that virus in ourselves, can then attack others that are in a weakened condition. And we don't have the antibiotics, or the antibiotics that we have to be constantly redeveloped, and become very expensive in the process. We've also seen a growth and rise in infectious disease with growth of cities. We've definitely become a more urban environment, and we have very, very large cities. So places like Mexico City, places like going into some of the cities in India, so we will see higher levels of disease in those processes because they're not contained. Globalization also adds to this modern profile of diseases as we come forward. And so when we look at the flu being carried from China to the United States, and the blocking of people and the concerns. So we see this increased business and travel, and the erosion of cultural traditions coming into place, which oftentimes were in place to protect people and society. And then we have the issues of environmental changes. In sociology, we look at the significant patterns that have occurred with global not global warming, but global weather changes, and those weather patterns coming into place. We know that we will have more severe winters and hotter summers as we look at that global warming, and with that, areas that are infected by pests such as mosquitoes. They travel to higher levels and more people become infected, and we see things like the West Nile virus being carried in the process. So some real changes as we look at this modern profile coming into place of the disease process. So as we look at the main causes of death, we can see how they've changed. In 1900, influenza was the top level of disease. Obviously an infectious disease that comes into place. Today, we're looking at heart disease, and heart disease includes multiple things that come in place within that, but that is a chronic disease, and you can see the difference that goes back and forth. And so issues down here, when we look at diabetic, about 24 per 100,000 as we look at that numbers, the rate per 100,000 of where those deaths are. So very much a different world from this fear of infection that comes into place. And the change of even our culture can be seen in the diagnoses today. So the social sources of premature death we can see come into place, and there are multiple things that we focus on within that and how they come into place. So aging is part of it. We see such things as tobacco and tobacco use as very much in the process. The increase of alcohol affected diseases, and so we see the influence here of kidney disease and diabetes can be highly affected within that process. You know, since the 1960s, the research has linked smoking and lung cancer, and yet we still have some very clear open availability to what we call the brown plague coming into place and the effects it has on other things. We also know the effects of alcohol, not only related to traffic death, but to chronic diseases that occur within the body. And then we have the introduction of illegal drugs in society. We have yet to study other things that come into place, such as the new legalization of marijuana in certain states, and we'll have to be watching within that process. Though marijuana had been legal when alcohol was illegal. So remember the social influences that come into place within that pattern. We also know that diet and exercise are very important, and we look at obesity rates. Your book goes into those very clearly, at the increase of obesity in the United States as well as other first world countries especially. And so we see this changing culture in our way that we work, the way that we survive our day. In that process, the increase of motor vehicles leads to the obesity rates, as well as it increases the deaths by motor vehicles. And then we have the issues of firearms and sexual behavior. Health lifestyle theory emphasizes the look at the group rather than the individual behaviors of society. And it looks at our behaviors are affected by our living conditions, our demographic circumstances, and our cultural membership. So what are we saying about that? So living conditions make a significant difference. If people are living in housing that is unsafe and may have lead paint or asbestos in it, then their healthcare behaviors, their health is care is affected by that. Also think about people living in unsafe neighborhoods where it's unsafe for children to go out and play. And they have to be monitored. They may be sitting in front of the television to be safe in a safer environment than being outside. Then we can also see the other living conditions that come into place as the introduction of technology, as you are sitting in front of your computer screen taking a class and not necessarily having the same active relationship of walking to and from class. All of these things become part of that living condition. Demographic circumstances make a significant difference as we look at the social stratification that comes into place, where we live in society. As we know, in the South, they tend to have lower incomes and are poorer, less education. All of those affect health behaviors as well, and that cultural membership. It's interesting as we study Jamaican populations in Chicago, as one researcher did, and why the infant mortality rate was so high, but they reject from their belief system the help from the traditional medical sources, and therefore do not have the same prenatal care that comes into place. So some pretty important things as we look at what affects the patterns of healthy and unhealthy behavior. Go back and even examine your own behaviors and how they come into place. It's important as we start looking at those social conditions coming in to the behaviors of individuals. Other issues include stress, emotion, and physical reaction. And we can see the effect of stress plays differently on chronic illness and acute illnesses. And as we explore that, you'll see that there is a significant piece as social stress comes into place. So someone who's born poor and is fighting for their survival oftentimes has shorter life expectancies, more likely to get chronic illnesses as they're exposed to them. So we see this continuation or this cumulative stress burden affects people's health as well. Significant ways that we respond to stress make a difference, and we notice the difference here too in the relationship of gender, race, class, and social stress as some of the underlying cause of illnesses. And that is the goal of sociology, to look at these things in any type of category, but especially here in medical sociology, we can see how powerful issues of gender are. Women live longer than men. They tend to seek medical help at an earlier age, but they have more chronic illness and at younger ages are disabled than men. Race plays a significant category into illness and as well. So there are race and ethnicity that ties into some diseases, but then we can see the power of that social class coming into place and the effects of social class and the social stress. Do I have a job? Am I worried about what all is going into place? What are they? So as you finish up this chapter and your readings within it, think about what are social networks and how do they affect health? How do they make a difference in your health versus your friends? Who's harmed or improved by their social networks? Think about the difference of the type of insurance even one can afford as we're looking at systems within the United States of what comes into play. So, things for you to consider within this chapter and this module. So where do you go from here? Well, I'm asking you to watch a PBS video, Back to the Basics, to give you some idea of that world and what the general pieces of medicine are. This is actually a RX for Survival, a global health challenge to explore it. From that point, then you would move forward after you've, of course, read your chapter before you begin there, and then complete the discussion board. Your assessment of this week's module is, again, a multiple choice quiz and is available to you here or under assessments, under quizzes once you've entered the module. With that, I hope that the second week has added to your knowledge, and I look forward to hearing from you. Have a great day.